Dr. Jenny Brown. Welcome to my YouTube channel. So at NRM, we are gearing up for National Infertility Awareness Week, April 23rd to 29th. And as part of this, we decided to start a YouTube channel to really get you a reliable source of information. We know that Dr. Google is a tempting resource. However, as a friend of mine likes to say, Dr. Google went to a questionable medical school. So here we go with this YouTube channel. I thought today we would start with who might come to see a doctor at NRM. And we are here for anyone hoping to conceive. We assist on all paths to parenthood. So, for example, you might come if you are under age 35 and you've been trying for at least a year and have not yet successfully become pregnant. We're here to help. That does change if you're over 35. We recommend you come to see us after trying for 6 months because of the effects that age has on fertility. That also would change if you know that you have something going on. If you know you have irregular cycles, for example, and aren't getting a period every month, then we wouldn't want you to wait a whole year before coming to see us, or a whole 6 months if you're over 35. If you know that you had a past surgery on your abdomen that might have affected your fertility, such as a ruptured appendicitis or another complicated surgery or infection in your abdomen, or maybe your male partner, if you have one, has known low sperm counts or a past surgery on the groin or testicles, that would be another reason to come see us sooner. We also see single individuals on their path to parenthood. So we help single females with donor sperm. That can be through insemination, for example, to help single females conceive. We also assist single males or male couples with the use of an egg donor and gestational carrier. So those patients come to us. In fact, those patients come to us from all over New England and New York, and even some international patients because of the favorable environment in Vermont for a gestational carrier giving birth for intended parents. So that's exciting. And we also help same-sex female couples. They might be undergoing inseminations with donor sperm, or they might choose to do reciprocal IVF, where one of the female partners is stimulating and using her eggs for the creation of an embryo with donor sperm, and then the other partner is using her uterus to carry the baby. So that's an exciting way to build a family. We also see and treat patients who have suffered from miscarriage or loss or recurrent pregnancy loss, and we're able to help with the diagnosis and hopefully the successful treatment and getting that baby born full term. We also help individuals who might not quite yet be ready to conceive, but might be in a situation where they want to preserve their fertility for the future. For example, if a female is in her early to mid 30s and maybe doesn't yet have a partner and wants to preserve the option for the future, we can see and evaluate your fertility and talk about freezing eggs for down the line. The other individuals that might want to preserve fertility for the future would be someone that's beginning to start a medication, maybe for an immunologic reason, or maybe for chemotherapy for a cancer diagnosis, in which that medication might affect their future fertility. So in that case, we would help by preserving eggs before the medication started that could be used down the line. Those are some examples of the patients we see. It's not all-inclusive, but we are all-inclusive. So don't hesitate to reach out to me, Dr. Jenny Brown at nrmvt.com, and we're happy to answer any of your questions and individualize something for you. Hope to see you soon. Thanks.